Good afternoon and welcome everyone to today's webinar on COVID-19 Safety in Action, an example from the job site. I'm Cain, Executive Director at CPWR, the Center for Construction Research and Training. Along with NIOSH and OSHA, CPWR is holding this bi-monthly COVID-19 webinar series for the construction industry. You can access the whole series through a playlist on our YouTube channel. Jessica Bunting, our WebEx host for today, will share that link with everyone in a follow-up email. I also wanted to mention that we're holding our next webinar on July 16th, and it's going to be a great one focusing on contact tracing. I also wanted to mention that while I won't be presenting today, I wanted to remind folks we have the COVID-19 Clearinghouse, and we'll post a link to the Clearinghouse in the chat in just a few minutes. We have a great team here today, and I'd like to thank them all for being here. We'll hear presentations from Amanda Edens, Deputy Assistant Secretary for Labor for Occupational Safety and Health, and she's the highest career person at OSHA. Dr. Scott Earnest, Associate Director for Construction, Office of Construction Safety and Health at NIOSH, and he's the highest construction guy at NIOSH, as well as Matt Eleazer, President, BAC Local 1, who covers Oregon, Washington, Idaho, and Montana, and he's a member of the Oregon COVID-19 Joint Construction Safety Task Force. After the presentations, we'll be doing questions and answers with Scott, Matt, and myself. Amanda won't be able to remain on the line until the end of the webinar, but Scott Ketcham, Director of the Directorate of Construction, is here and has offered to follow up on any questions we can't answer after the webinar. Please enter your questions in the Q&A box at any time. We did receive a number of questions in advance. We will try to get through as many of those and the live questions as possible. And now I'll hand it over to Amanda to get started. Thank you.
Thanks so much, Chris, and I thank you for letting me jump in on this webinar at the last minute. I think on the last one with Scott, you had Chris Brown, who is sort of our resident expert with all things COVID. He was busy today, as is Andy Levinson. We're trying to man a lot of different COVID webinars, speeches, chats with different people. The construction industry is obviously a very important stakeholder for us, so I didn't want to just leave it all to Scott, although he's a very able person. I am not Chris or Andy, but I do have some, background in infectious disease myself. Back in the day, worked on the bloodborne pathogen standard and some other things. So I really appreciate these groups doing these kinds of webinars because I think it's important to get as much information out to people as possible. These are really challenging times, and having venues like this to share information, it is just, I think, helpful to people who are trying to meet the different challenges that all of us have, either professionally or personally, as we go about trying to protect others and to protect ourselves. I'm not going to go, I did see some of the questions. Some of them were OSHA focused, and I don't want to sort of answer them necessarily. Not that I don't want to answer them, is that we have, in fact, some guidance on the web that directly addresses these questions, and I don't want to, take the chance of sort of misstating what we already have on the web. But I will say that, things around face masks, not face masks, but cloth coverings for your face. We do have some FAQs that I would wish people would look at, because it does answer some of the questions that were raised from the last time, and I know that people continue to have questions about them. So I do know that we do advocate wearing them, just like our partners at CDC. They can be a very important source control, but like other types of things, sometimes, I think you have to look at the different scenarios that in which you're using these kinds of things, as well as PPE that you might be using, doing hazards assessments, making sure it's appropriate. And, while these aren't PPE, they do have some of the same sort of issues as other PPE, when you're trying to wear them in heat and when you're trying to wear them with other kinds of things like safety glasses. And I think some of your experience from that might help. And I know NIOSH, even earlier today on a different webinar, had some folks talking about heat and trying to wear PPE. It's always a challenge. And, sometimes a heat program comes in with trying to figure out when you can wear certain kinds of PPE, the appropriate precautions to take when you are in hot environments. And we have some guidance on the web with that as well as NIOSH. So I hope you take a look at that. You also had a number of questions on testing and, record keeping and reporting. And also we do have, again, we have guidance on that. Our most recent return to work guidance does talk about testing, as not an OSHA requirement to test, but some employers might want to do it. And I would really point you to some of the sections in our guidance because I think there's some important points to know about testing, when it might be good, when it might, give people maybe, it's only good for when you take it. It doesn't necessarily mean that, people that might have other symptoms or asymptomatic people might still be there. So it doesn't replace, some of the social distancing. So I would point you to that because we have taken some great strides to help people sort of navigate through that. We have information in our guidance about whether or not some of those things would be under our access to medical records. And so we have, some guidance on that, when it would and when it would not. And so I'd point you to that as well. The other people I would point you to for testing is, CDC. As a part of the federal family, I have spent the last 4 months not only developing stuff for OSHA, but also reviewing a lot of the information that comes across, and CDC has put out quite a lot of information on testing in different kinds of environments. And so you might want to look at that because there's different kinds of scenarios for different types of work settings, and they have a lot of that information out there that might give you some guidance about when and if you might want to use testing as a screening mechanism on your work sites. I'm not really a testing expert, and I did hear on earlier, Chris was talking about contact tracing. That CDC is doing a lot of work in that area too. The other thing I would just say is around recording and reporting. I think some people have misinterpreted our guidance that it doesn't apply. It only applies to healthcare. That is not the case. We realize that there may be scenarios where it may be challenging to determine if something is workplace associated or it's coming from the community, but that does not erase the obligation that employers have to record and to report cases of COVID if they are work-related. And so we try to make that perfectly clear to people that while we're trying to acknowledge that some people may have difficulty, the obligation still exists with employers to do that. They need to record them, and they need to report them when they make a determination that it is work-related. And we try to give some scenarios to help people understand in what cases we believe that it would be likely to be work-related, and in some cases where it might be difficult. So I would point you to those. We've also done a number of guidance documents on respiratory or enforcement guidelines, I guess, on respiratory protection, to where we're directing our COSHAs where they may have situations to exercise some enforcement discretion. But I would say that what it does not do is just give people a free pass not to do what they need to do to comply with OSHA's respiratory protection standard where it is needed and where it is required. If you look at those enforcement memos carefully, it lays out a lot of different things that an employer must do before he resorts to doing things which may not comply with the respiratory protection standard. And we're directing our COSHAs to look very carefully at that. It is not like a free pass to just use, international respirators or decontaminated respirators if they have not done the other things in those memos, like make sure they've made all tries to get the appropriate PPE and do other things that will comply with the standard. These situations are only in the last resort because we are, in some situations, not all, employers may still be having some difficulties getting NIOSH certified in 95s or better. But there are lots of things we want people to do before they go to those other options to really try to, engineer it out, use other higher orders of respiratory protection where they can, and, do everything they can to comply with the standard. And so I don't want people to, where if you hear situations where people are not doing that, please, call the area office. Chris, you can call me. We'll look into those kinds of things. So we are very serious about the need for respiratory protection, and we don't want people misusing these memos to do things which we don't think are appropriate. And so I don't know that I have much more to say than that. I work and continue to work on doing inspections. We're opening inspections. We're handling complaints, and we'll use authorities where appropriate. I would say the one question was on there was, would OSHA or CDC take preference if there's conflicts? Like I earlier said, we're working with the federal family and reviewing each other's materials to try to prevent any sorts of conflicts unless there's just a difference in jurisdiction or authorities. But where there isn't, we're working very tirelessly to make sure we don't conflict with one another so that we are speaking with one voice. However, that's not to say it couldn't happen, and if it does, I would help. It'd be help to us if you could let us know. Call Scott, call me. Talk to the Office of Communications. We have a number of people that are working to try to make this so that we are speaking with one voice when it comes to certain topics. So always looking for your feedback. Always appreciative of hearing what you think, even when you think nobody's listening. We are. We're trying to improve things. We're working hard, just like all of you out there, and we appreciate the input. Critical feedback is always necessary, and we welcome it. And I think I'll leave it at that unless Scott wants to add anything else.
No, I have nothing to add, Mandy. Thank you very much.
Yeah, I think as Chris mentioned, I have to leave at the bottom of the hour at 2:30. I have another COVID call. So I think I will just leave it there. And unless you have a really quick question, I'll pass it on to the next presenter.
All right, I don't think so, Mandy. I appreciate you joining us for the time you had available, and while you were talking, I found some of the directives and other guidance that you put out and posted it in the chat for folks. They can click on the links and see the documents you were speaking of. So thank you for joining us, and with that, we'll turn it over to Dr. Earnest.
Okay, thank you, Chris, and it's good to be here this afternoon, and good to be with all of you. We continue to have a great deal of activity going on related to COVID-19 in the construction industry, and as many of you are aware, there have been recent cases occurring in the South and the Southwestern parts of the United States with higher rates in Florida, Texas, California, and Arizona. And some of these states are reporting record numbers of new cases. And because of that, a number of the states are beginning to pause some of their reopening efforts. And so this is really a time for caution as we go into the Independence Day weekend. I wanted to just remind everybody that there's a tremendous amount of information on the CDC's website, just like there is also on OSHA's website. On CDC's website, there's 1,400 individual guidance items that are available. So if you haven't checked it out, I highly recommend you take a look there. Also, as we go into the weekend, I just want to encourage everybody to remember to implement social distancing, wear face coverings when you're out and about, and also practice good hygiene and hand washing to reduce the likelihood of spread. The other thing that's important to keep in mind if you're doing any traveling over the weekend is just to try to be aware of where you're at in the U.S. and the areas, because there's outbreaks in different areas, and some areas have higher numbers of cases than others, and so just kind of keep in mind where you're located. Again, this is a big effort, and we're working with a lot of different partners, including CPWR, OSHA, and the NORA Construction Sector Council. We have a work group that's doing a lot to help address some of these issues and to incorporate important information into the COVID clearinghouse that CPWR is setting up. Just had a few things I wanted to touch on today. I wanted to talk about a number of morbidity and mortality weekly report articles. That's a publication of the CDC, and Again, they come out frequently, and there's been quite a bit of information in there about COVID-19. And then I wanted to just point you to another resource that we have on the CDC website, which is the Resuming Business Toolkit. So I just wanted to go through some of the things that are on there. So the next several slides relate to articles that are in the CDC's MMWR. And the first one has to do with hospitalizations. And surveillance data that's been reported to CDC through April of 2020 indicates that COVID-19 leads to severe outcomes in older adults and also individuals that have underlying health conditions. And so among the COVID-19 cases, the most common underlying health conditions that were reported were cardiovascular disease in 32% of the cases, diabetes in 30%, and chronic lung disease in 18%. And again, I just wanted to remind folks that hospitalizations are 6 times higher and deaths are 12 times higher for individuals that have underlying conditions. So we need to keep that in mind if you personally have these conditions, or if your coworkers on the job have these kind of conditions. We need to really be careful, even more so, because of the severe outcomes that can occur. Also wanted to point folks to another MMWR article on national surveillance data that suggests that there's been a decline in emergency department visits during the COVID-19 pandemic. And the issue here is that basically data has showed that for emergency room visits, there's been a decline of 23% for heart attack, a 20% decline for stroke, and a 10% decline for blood sugar issues. And so I just want to remind everybody that if either yourself or, for that matter, a loved one in your family or coworkers are suffering from these types of conditions, it's important to seek medical help. The hospitals in general have taken precautions to prevent infectious disease spread in the hospitals, and chances are all of these conditions really haven't slowed down because of the pandemic. As a matter of fact, they may have increased, but it's important to make sure that you get emergency care if you suffer from any of these health conditions. Another MMWR article that was interesting, and I just wanted to touch on, had to do with the spread of COVID in a choir practice activity. And so the details of this, and it's in the article, but following a 2.5-hour choir practice that 61 people attended, one patient or one individual who was symptomatic showed up to the choir practice, and after it was over, there was clear spread of COVID amongst many of the members. So there were 32 confirmed cases of COVID after the choir practice, and there were 20 probable secondary COVID cases that occurred. So just obviously a very large number of people that were involved in this choir practice got the disease from one individual. There were 3 patients that were at the practice that ended up being hospitalized, and 2 of them died. And so really the takeaway is that in looking at what happened in this particular case, transmission was likely facilitated by the members of this choir that were in very close proximity within 6 feet of each other, and also because of the fact that they were singing. And singing and talking, these types of activities can result in droplet spread. And again, the CDC considers that the primary means of spread of COVID. And so takeaways are to avoid large groups of people that are in close proximity to each other. And the other thing is, again, to remember to wear cloth face coverings. Cloth face coverings are intended as a source control. It's not going to prevent you from breathing in, necessarily breathing in, small aerosols, but it will prevent, if everybody in a group that is in relatively close proximity are wearing cloth face coverings, it'll help prevent each individual from expelling droplets that can contact others in close proximity. And then the last MMWR article I wanted to touch on had to do with support for the public health measures, such as 6-foot distancing, staying away from groups of 10 people or more, or just staying home. And basically, this was data that the CDC had collected between May 5th and May 12th of 2020. It was a survey among adults in New York City and Los Angeles and other parts of the country, and it found that in general there were fairly high levels of support for the mitigation measures that have been recommended for the public. So there was 88% support amongst the public for social distancing of staying at least 6 feet away from each other, 82% support for trying to avoid large gatherings of 10 people or more, and then 80% support for stay-at-home orders, which is all, very, very good. And then the last thing I wanted to just touch on is this important new document. It's a toolkit that's on the CDC website. It's called the Resuming Business Toolkit, and it's basically lays out a bunch of different measures to reduce the spread of COVID-19 in the workplace as individuals return to work. And some of the things that are in this toolkit include an employer sheet that introduces employers to the content of the toolkit. There's a readiness checklist to help make returning to work and resuming business operations as safe and as healthy as possible. There's a worker protection tool to help identify protective measures for workers, an infographic, and then a list of a bunch of important resources. The next slide just kind of shows how the checklist is laid out, and there's a lot of really very helpful information there. It touches on topics such as how to conduct a hazard assessment, action planning for suspected or confirmed cases, how to protect high-risk individuals. So lots of really good information in the checklist of this document. There's also a whole series of resources that are referred to in the toolkit. And this just shows the beginning of it, but there's just a tremendous amount of information there on how to contact your local health department, links to the EEOC, information about the Americans with Disability Act and how that plays a role in COVID-19 screening, stress, dealing with stress on the job, travel guidance for different areas, list of disinfectants that have been approved by the EPA. So I just wanted to make people aware of that resource. There's a lot of really good information in it. And then finally, just to wrap things up, I just wanted to point to information related to construction. So there's a CDC guidance on construction. There's a CPWR clearinghouse. OSHA's put out guidance for the construction industry. And again, at the bottom, if you want to actually talk to somebody, you can always call the 1-800 number for CDC. And that wraps up my summary for this week. Chris?
All right, thank you, Scott. Next up, we've got Matt. Matt, we're ready to go, and we'll advance to your slides for you. Either Jessica or I will. So please proceed.
All right. Well, thank you. Good afternoon, everyone, and happy Friday for a lot of people. My name is Matt Eleazer. I'm a 24-year member of the International Union of Bricklayers and Allied Craft Workers. I'm a bricklayer and stonemason by trade. In addition, I've been an officer of BAC Local 1, which covers Oregon, Washington, Idaho, Montana since 2005, and president since 2011. I'm also a member of the Oregon COVID-19 Joint Construction Task Force. We're in some trying times right now, and our number one goal is to keep our members, our contractors, and everyone in the construction industry safe while performing the essential construction projects across the Pacific Northwest. Today, I've been asked to provide a brief overview of the Oregon COVID-19 Joint Construction Task Force and share some examples of how our union and our signatory contractors are working together in the Pacific Northwest to prevent exposure and the spread of this disease. Let's start with the Oregon COVID-19 Joint Construction Safety Task Force. In late March, as the spread of the pandemic started to hit the United States, Robert Camarillo, the executive director of the Oregon State Building Trades and Construction Council, came up with the idea of putting a small group together to help develop the best practices on all construction projects throughout Oregon, residential and commercial. What developed out of those thoughts was this task force, which includes representatives from the building trades unions, contractors, employers representatives, academics, Oregon OSHA, and the Oregon Institution of Occupational Health Sciences. Through this task force, union and non-union groups who typically don't work together are now working jointly with the goal of improving job site safety, increasing educational resources during these incredibly challenging times. Since then, we've been meeting via Zoom from the early beginning, two to 5 times per week, depending on the issues that are popping up. And a group of 5 to 7 of the task force members assisted Oregon OSHA consultants and have been visiting job sites to access the effectiveness and safety practices intended to address COVID-19 and to make recommendations for improvements. During these visits, all task force members and Oregon OSHA consultants practice social distancing and wear all the appropriate PPE on these job site visits. At the same time, the task force has been monitoring the most current health information and government guidelines and collecting data and information about the best job site practices. This data and best practices were being shared with construction contractors and workers across our region. And now, through the CPWR COVID-19 Construction Clearinghouse and this webinar to a national audience who can benefit from what we've learned. So far, we've compiled best practices such as using roll call instead of manual sign-in sheets, sharing building plans electronically, using a safety whiteboard where workers can express concerns and the contractor can reply with a solution and a date, and using a COVID-19 job site checklist. I'd like to use some of the next few slides to share photos of some other examples of best practices identified and shared by the task force that we've put into practice. Addressing areas where workers are in close proximity, such as choke points, and walking areas on job sites is critical. The photos in this slideshow show examples of how signs and markers have been used to maintain 6 feet between workers and workers moving throughout the job site. Designating separate entry and exit points. Another good practice is designating separate entry and exit points to help maintain social distancing. This slide shows images of signs that are being used to designate which stairs for workers are going up and workers are going down. On almost all of our big projects, there's at least 2 exit points and entrance points on the job sites, and we're able to use a stair to go up and a stair to go down. Adjusting crew work areas. Once on the job, the task force have been identifying ways to stage work and maintain social distancing. This photo shows one example. As you can see, each of the workers are performing work at different levels on the wall, spreading out as much as possible throughout the workday, while still being productive and getting the job done. Sanitation in high-touch areas. Sanitation is a huge issue because porta potties are close together and always in high-touch area. This slide shows them placed at least 6 feet apart and ready access to hand washing stations to encourage hand washing before entering and exiting. Also, these porta potties are being cleaned multiple times a day, unlike once or twice a week prior to COVID. Creating solutions. Sometimes you have to get creative. The first photo shows a hand sanitizer station fabricated out of wood with a safety data sheet attached for easy reference as part of the contractor's hazard communication program. The second photo shows 2 workers performing a task where social distancing wasn't an option, so a sheet of plexiglass was put between them to prevent exposure. Communication and training. The task force is also recommending ongoing communication and training for best practices, so stay tuned for more to come. One of our biggest challenges was limiting material handlings on jobs. Within our own union, working with our signatory contractors, we've been implementing best practices identified by the task force and addressing challenges that we incurred on job sites. One of the major issues that popped up for us was 12-inch concrete block projects. To reduce strain and sprain and injuries from manually lifting and moving heavy block, our collective bargaining agreement requires 2-person teams for 12-inch block. Some of these blocks on these projects are in excess of 75 pounds per unit. With COVID-19, we wanted to find a way to limit the number of workers touching material while still maintaining a 6-foot distance. Working with our signatory contractors, we decided to try out a mule as shown in this photo, which is a hydraulic-assisted boom. We found a few and we were able to place them on job sites with great success. The workers were able to stay 6 to 12 feet apart while still performing the duties of laying 12-inch block. On other CMU projects, one of our contractors also hired boom trucks to place grout instead of using the traditional line pumps, which require multiple masons standing shoulder to shoulder to grout the walls. To encourage the use of face coverings when working 6 feet or more from other workers. My local union recently purchased face buffs for our members and are currently handing them out on all job sites. These buffs, which our members in these photos are wearing, are much easier to breathe than other face coverings. While they're usually used while fishing and engaging in other outdoor sports for sun protection, we're letting our workers use these face coverings when they're working 6 foot or further away from other workers. I want to emphasize that, like other face coverings, these are not medical grade. They are not a substitute or protection when working in close proximity to others or engaging in a task that requires a respirator to protect themselves. Keeping the next generation safe during training. The final example concerns how we're protecting those individuals new to the trade who are attempting to attend apprenticeship classes. Prior to the COVID-19, the size of our apprenticeship classes were typically around 20 to 25 students per week. To protect students, we're now limiting the class sizes to 8. We've spread out the tables in the classroom, and we're only putting 1 student per 8-foot table. When the students arrive, they're required to fill out a questionnaire every morning and have their temperature taken before they enter the classroom. We have access to hand sanitizer, and we have it readily accessible, and the room and the desks are sanitized every evening before the students leave and after they leave. We've had great success so far, and we're proud of the progress that we're making with our apprentices pathway to become journey workers in their trade. In addition, my local's efforts and work through the task force, my international union recently asked for a few videos of our members on the construction industry, how it has changed for them, and to show what they're doing safely. I got the thought of doing a Facebook video contest giveaway and encourage members to practice these new safety procedures and to take the disease seriously. The contest was a great success. We received over 20 submissions on different job sites and of what has changed for them on a day-to-day level. I'd like to share one of the submissions of the video for you now.
What's up? This is Simon with the BAC1. Work for Bratton Masonry right now. Just wanted to show you guys how we're staying safe from COVID. We got our hand washing stations, our signs. Really cool about it. We got these machines right here. Mules. Badass. Yeah, bud, that's a 12-inch block. That's how we're staying 6 feet apart. Stay safe out there.
These are just a few examples of how the Oregon construction industry and the industry as a whole and the members of my union and our signatory contractors are responding to the pandemic. All in all, it's going pretty well. Our members are working very safe. Our contractors have done an excellent job and have gone the extra mile to ensure everyone's safety while working continues during this pandemic. I'd like to thank CPWR for the opportunity to share with you all in hopes that you guys can work safer too. Thank you.
Well, thank you, Matt. That was just great. I really appreciate you sharing some of the good things that are happening out in Oregon with us and others who are participating in this webinar. And with that, I'm going to move right into the questions and answers. So I hope you all are ready. The first one I have is actually was covered by Mandy, but Scott Earnest, the same question that Mandy addressed, she looked through the questions that came in advance, and I really appreciate that, answering a lot of them. The question is, would OSHA or CDC take precedence in the case of a conflicting directive?
Yeah, and I mean, I think Mandy nailed it, which is the bottom line is, we're trying to do everything we can to be of one voice, across the federal government. And so that, with OSHA and NIOSH in general, we're trying to make sure that we don't have discrepancies in guidance where we're, one agency saying one thing and another saying something different. But, if there are situations like that, we would be interested in hearing about it and trying to figure out what needs to happen to resolve any sort of conflict. The one thing I would say, though, is that, when it comes to OSHA is a regulatory agency, NIOSH is not. So, a lot of what NIOSH puts out through the CDC is guidance. And, in many cases, OSHA's putting out regulations that are required by law. So I would definitely take that into consideration as well if it's a regulatory issue. But in general, as part of the family of the federal government, we want to try to be as consistent as we possibly can be.
Thanks, Scott. The next question I have is for you, and it's also, I think, reflected in one that may have come in through the chat. But the question is, should COVID-19 be treated the same as wearable protection from flying metal chips while drilling?
Okay, sure. Thanks for that question, Chris. And my interpretation of that has to do with use of face shields, because typically if you've got metal flying, you would have eye protection or face shields that you'd be wearing. And so what I would say about the use of face shields as both PPE and as source control is that they are being used, and they can be effective at reducing the spread of COVID. So there's benefits for it. Face shields can help minimize contamination of masks, and they can also help with the use of cloth face coverings. However, if face shields are used, they need to be cleaned and decontaminated after each shift. And then the other thing is they need to extend around the size of the wearer's face and also below the chin. But at the current moment, we don't view face shields as a complete replacement for a cloth face covering. So we would still recommend, even if somebody is wearing a face shield, that they also wear a cloth face covering in addition to that.
Great. Thank you. This one is from Matt. Any tips on wearing masks and safety glasses when performing a task, or also about wearing masks in the heat?
Okay, so two-part question. Our guys wear safety glasses all the time. Almost all the job sites mandate them to wear safety glasses. With our guys being in the masonry industry, they have to deal with silica. So we're pretty used to wearing N95 masks all the time. A tip would be most of the local dive shops, or you can even get it on Amazon, is the anti-fog, and use that on the safety glasses. So that works really, really good. If you have a guy that or a female that can't seem to get through the anti-fog, Elvex makes some steel meshed lenses, and those work pretty well. They're safety glasses that have a steel mesh in front of them. Guys have a hard time laying brick with those, laying to a line and doing precision work. But if we have some restoration guys or guys that are putting coating on, our crews that are just doing general labor, it seems like they can get away with that. It makes it a little bit easier. And what was the second part of that question?
Any tips on dealing with the heat or the feeling that folks get of being hotter when they're in a cloth mask?
Yeah, I guess to go back to that is we're all in the construction industry. We've always wore masks. The one thing is to make sure that the guys are drinking lots of water. That's a big deal to keep hydrated. But for the most part, this isn't really new business for us in our industry, having to wear something over your face. A good tip would just be keep yourself hydrated and make sure that everybody checks on each other throughout the day.
Great, thank you.
Chris, this is Scott. I wanted to see if I could weigh in on the heat stress one a little bit as well. I wanted to mention that one, there's some very good guidance from OSHA on dealing with heat stress issues. So in addition to staying hydrated, you can shorten worker shifts. You can incorporate more frequent breaks, and also just training the workers to understand what the symptoms are of heat illness, so that if they start to suffer those kind of things, that they take steps to address it adequately. The other thing I wanted to mention about heat stress and preventing heat stress is that if you can modify physical activity and work rates and that sort of thing to also help reduce the amount of thermal load that the body is dealing with when they're doing a job. And then there's also personal cooling methods that can be applied to help reduce heat. But, you know, as Matt said, I mean, this is a very common problem in the construction industry. And, you know, with the wearing of, you know, face masks, or for that matter, respiratory protection, you know, that can definitely increase the, you know, the heat load on the body, and, you know, the feelings that workers are suffering. I wanted to mention that NIOSH has just recently, in the last month, funded a whole series of additional studies, one of which is looking at the effect of wearing masks and heat, and trying to identify ways to help minimize some of the issues there beyond what we already know.
Right, and we recently learned of an article that was published several years ago on the basic takeaway from the article was that while respirator, in this case, use sometimes made the wearer feel more hot or uncomfortable, it didn't significantly add to the heat burden on their body. And we'll be posting a link to that in the clearinghouse under the studies section. So just stay tuned as we get more information related to the questions. You know, we try to find resources to answer them. And this is, you know, just to kind of step aside from the questions, these questions are so important because they're helping us determine what's going to be in the next webinar, and what materials we need to find to put in the clearinghouse so that we can point people to science-based information on the questions that our industry has about this pandemic. I'm going to go to one that came in through the chat now, and this one's for Matt. For safety training or apprenticeship training, would you have considered any web-based or online training modules?
Yeah, that's an excellent question. Some of these classes we cannot do. We're very hands-on here. But some of the classes we can. Construction math is one that we're working on right now to try and, because we don't know when this is going to end. And so we're actually working on construction math right now and doing it online. The only problem is we have to make sure that every single one of our members has access to internet and has access to, you know, either a smartphone or a tablet. And that's kind of one of our issues. Covering 4 states, there's a lot of people that don't have technology, and we need to make sure that whatever we offer is for everyone. So that's one of our hurdles. But yes, that is something that we're definitely trying to do. The OSHA 10, the OSHA 30, we can do these classes online, and that's going to help in the future. Try and keep our guys trained, and it's a very progressive question, and that's something that we've been working on through with our International Masonry Institute. We're trying to get these classes done. As much as we can do online, the better.
Thank you for that answer, and I think you hit on something that, you know, this is going to go into the future. I wanted to just flag in our clearinghouse, we have a section on training where we do have posted links to asynchronous training that some of our partners have developed, as well as training materials for folks to use around the COVID issue specifically, not the skills issue that you were asked about. But that kind of leads me into the next question for Dr. Earnest, and the question is COVID-19 here to stay?
Yeah, so, you know, that's a difficult question. I think there's a number of factors that really come into play in terms of, you know, how long we're going to be dealing with, you know, COVID-19 and these issues. One of the things is just, you know, progress on the development of a vaccine. And, you know, it's obviously an extremely high priority around the whole world because everybody's being affected by this. I know there's a tremendous amount of, you know, pharmaceutical biotechnology companies that are working on vaccines. You know, the government is heavily involved in that. So that's going to be a key factor in terms of, you know, how long we're going to be dealing with, you know, the pandemic and the effects of it. Another element to this whole thing is also just the you know, the number of people that are exposed and contract it, because there's something called herd immunity, whereas eventually as more and more people get exposed to it and develop some level of resistance, that can play a role as well. So I guess what I would say is, you it seems like, at least for now, for the foreseeable future, we are going to be dealing with this. But there's a lot of people, a lot of resources being poured into vaccine development, and I think that's really the critical issue is when will we have a vaccine, and that will make once we have it, that will make a major difference. Although there's a whole other issue of just getting basically you're talking about trying to vaccinate the world, which is a major undertaking in and of itself. So there's a lot of issues there.
It sure is. But on the bright side, a question for you again, Scott, is does research regarding simulated sunlight deactivating COVID-19 have implications for artificial lighting in the workplace?
Yeah, so that question, that's kind of I think a follow-up from, when we met a couple weeks ago, because there was a relatively recent article that came out, and it was published, I believe, in the Journal of Infectious Disease, and the title of it was Simulated Sunlight Rapidly Inactivates SARS-CoV-2 on Surfaces. And it was pretty exciting because again, this is one study, but the study seemed to indicate that if you're outside and you're exposed to sunlight, there's some real positive effects and likely minimizing the effect that the virus can have on you because it would deactivate it. But I would say that there's a big difference between what happens outside and what happens inside. I mean, generally speaking, if you're outdoors, you're going to generally have it's less likely to transmit the virus outdoors than it is indoors because you're going to have natural ventilation, and there's a less likelihood of super close contact. Whereas if you get into a confined space inside of a building, you might have poor ventilation. Just the proximity and the lack of airflow can play a role. But really, to get to the issue of simulated sunlight versus artificial lighting inside of a building or elsewhere, I think there's still a lot of work that needs to be done to address this, and I would say it's probably too early to say whether or not the research from this study would apply to artificial lighting. So that's kind of a long answer, but it's really too soon to say. I would not make that conclusion that just because this study showed that simulated sunlight can deactivate it, that it has widespread implications. I think there's a lot more work that needs to be done to better understand things.
Yeah, thank you, Scott. I mean, we're learning more about this disease every day, but we still have an awful lot to learn. But we need to keep trying to translate the science and get it out there the best we can. One commenter wanted you, Matt, to take some credit for reducing musculoskeletal risks by using those hydraulic lifts for the CMUs. So kudos to you for that intervention. Just wanted to let you know somebody sent that in privately, but also asked if there are examples of procedures for this issue. And I think if I'm getting the question right, yeah, we have examples of programs and we have examples of solutions that folks have found. So on the COVID-19 clearinghouse, there's checklists, there's model programs, there's a whole bunch of resources that were developed by trusted partners in the construction industry that have a lot of credibility. We're also adding to this clearinghouse, and we'll be equipping it with new tools and help in that regard soon. But the safety and action category in the clearinghouse has some specific examples of that we've gotten from folks in the field and from people like Matt and through the news of innovations to address social distancing challenges, hygiene challenges, and things like that. So there are specific examples in there. And this leads me into the next question that I see, and it was to you, Matt, regarding the plexiglass barrier. It says the plexiglass barrier showed in the photo. The asker is assuming it's a mobile barrier and was inquiring about the weight. And maybe you could talk a little bit more about that plastic barrier.
Yeah, that wasn't one of my contractors using that, so I can't really speak to that. I have seen it on job sites where they've had a plexiglass barrier working in between two guys that were caulking very close to each other. And it was like a little panel. So I can't answer to that. Those were guys doing mechanical work, and I don't represent those trades.
Okay. No, fair enough. But I think it does show some innovation in that we can, you know, create a droplet barrier between people in innovative ways. So with that, I want to go to another question. This one's for Scott. It's about ADA and temperature readings. When employers collect temperature readings from employees, the results are covered under ADA. How do you provide best practices for screening privacy and maintaining records in accordance to ADA?
Okay, sure. Thanks for another great question. And there's guidance for this on the CDC website, but basically when we complete health checks, we want to do it in a way that maintains social distancing. Also, when you arrive at a construction site, you want to have multiple screening entries into the site. In terms of actually doing testing of the employees, you want to ask the employee to confirm that their temperature is less than 100.4 degrees Fahrenheit, and also confirm that they're not suffering symptoms such as coughing or shortness of breath. You also should be doing a visual inspection of the employee for signs of illness. It could include things such as flushed cheeks or fatigue. And then the other thing is, it's important to, when you're doing screening of workers, that the screener stands behind a physical barrier, such as, just as you were talking about with Matt, such as a glass or plexiglass to provide a partition between the screener and the person being screened. Also, when you're performing temperature checks, the person doing it should be wearing a pair of gloves and a no-touch thermometer. So there's just a number of different measures that should be done to make sure that you're doing it properly and reducing the likelihood of spread, and also doing it in compliance with ADA.
Okay. If I can flip screens here. One of the folks who's participating in the webinar said that if the temperature is not recorded on the health check, only yes or no plus yes or no symptoms, is this considered a medical record by the OSHA definition and must be kept for 30 years? So that's a great question, and I know that we don't have. I know Scott Ketcham is on the line. If he can identify a resource where OSHA has answered that question, maybe you could put it in the chat for everybody. I don't know if OSHA's answered that question yet, so.
I'm looking right now.
Okay, so if we don't have if we don't have an answer for you by the time we wrap up in about 5 minutes, it'll be one of the things that we get addressed afterwards. And hopefully, some of these questions we are not going to get to, but they help inform what folks want to know, and we'll cover them as soon as we can in the next webinar in the series. Although I'm now looking at my cheat sheet and seeing that a similar question came in advance, and Scott Earnest volunteered to answer it. Did you want to address the issue of screening records as medical records, Scott?
Sure. Yeah, I'd be glad to touch on that. So the Americans with Disability Act requires that all medical information for employees be stored separately from the workers' personnel file, so that you have limited access to what's considered confidential information. The employer can store all medical information related to COVID-19 in the medical file, and this includes an employee statement, as to whether or not he or she has the disease, or if they suspect that they have the disease, and then also any employer notes or documentation related to the employees and symptoms. And then it's important to make sure that when you're dealing with medical records, that you follow guidance from the EEOC regarding the confidentiality of the medical records related to health checks.
All right, thanks, Scott. I'm looking through some of the questions that are coming in, and there's a theme, and it's regarding exhalation valves on N95 masks. And I didn't talk to anyone about answering this question in advance, but this is a question that's near and dear to my heart. The question is, so cloth face coverings are intended to reduce the spread of the virus from an individual who may be pre-symptomatic or asymptomatic. That's the idea behind cloth masks. They're not intended to protect the individual who is wearing the mask from virus that may be out in the air. However, they may offer a little protection. The idea is if everyone's in cloth masks, then the idea that everyone is controlling it as well as it can be controlled at the source, so it's not in the air around the workers. This question is for respirators that are used on the job with exhalation valves. The exhalation valve allows unfiltered air to leave the face piece of that respirator. And this has been a challenging question to me and to a lot of other people, and I've heard about how some folks are addressing it. One of the things is, from my perspective, this is Chris from CPWR, when respirators need to be used because of the presence of a health hazard, such as when you're working in close proximity to other humans in this pandemic, or if you have a health exposure on the job that you need to address with respiratory protection, you're going to have an exhalation valve on that respirator almost all the time. The only exception would be the filtering face piece respirators that don't have valves, which are difficult to come by these days because of supply hasn't caught up with demand. So yes, I think there is a potential for virus to come out through that exhalation valve, and that's something we have to think about. And I think as humans, we have to think about that in the grocery store when you see people walking around with exhalation valves in their masks. However, I would argue that the exhalation valve does provide some droplet protection the same way as a face shield would, because the path of the air is not a direct line from the wearer's mouth, droplets spreading at high velocities through the air. I don't think it's perfect. At the same time, I think if you have workers in respirators, they're all in respirators. You don't have a person in a respirator next to a person in a face covering, because that's not consistent with protecting workers who are exposed to the virus. So that's my argument. I have also heard of contractors who, if a worker is using a respirator with an exhalation valve, will require the worker to put a surgical mask or some type of mask cloth over the exhalation valve to reduce the potential for droplet spread as well. Those are two potential solutions. I think that this is a question that we can't really answer today because I don't think we know enough science about it. One of the other questions I don't think we know enough science about, I'm going to ask Scott Earnest, I think, as the last question. And the question came in early in the webinar, so I wanted to address it, and I don't think I'll get the wording right, but I did look at it. And the question is, where is the science on the use of cloth masks? How much do we know, and where are the studies pointing to as far as us understanding how effective they are at reducing the spread of COVID-19?
There have been some studies done on it. There's information. I can make some things available after this that Jess can make available to everybody that called in. But the bottom line is, CDC believes that cloth face coverings are extremely effective in reducing transmission through droplets for somebody who's infectious. So there have been studies that have been done on it. Particularly if you have a group of people in a confined area and they're all wearing masks, then it can be extremely effective and really dramatically reduce the likelihood of transmission. In terms of the level of protection, obviously it's a lot different than an N95 respirator or a higher level of efficiency of a respirator, but it's really a different approach. It's source control as opposed to a respirator where you're looking at filtering out the very small particles that are in the air. So there's studies out there. I'll try to make some of that available. There's also actually some really good videos that show the effectiveness of wearing a cloth face covering when you're talking, when you're coughing, when you're singing, and looking at how effective it is at reducing transmission at various distances away. So I'll make that available as well.
Thank you for that offer. I really appreciate it. And before we close up, I got word that we wanted to put a new slide up on the screen. And Jessica, if you're ready to do that, go ahead. And I'll take the opportunity to thank the folks from OSHA, Amanda Edens and Scott Ketcham, as well as our NIOSH person on the phone is Scott Earnest, as well as Matt, because really the content of these discussions are driven by the questions we get in these discussions. So if we haven't gotten to your question, we've heard it, and we'll do our best to try to address it both through materials we can populate into the clearinghouse and future webinars and information we get out to the industry on COVID-19. And with that, for closing remarks, Scott Ketcham.
Thank you, Chris. I just wanted to thank everyone for participating in this. And as Amanda Edens mentioned earlier, we are concerned, we are listening, and we're out to help as well. I did want to add in one additional thing, which is an outreach event that is going to be occurring, the National Safety Stand Down. And it's the date was announced yesterday, September 14th through 18th, 2020. This is in coordination with the National Construction Safety Week, which announced last week as well. And for this, our partners, all of us together, NIOSH, CPWR, NORA, and OSHA, are going to be working on getting information out to you as the stakeholders on how to do a fall stand down in the COVID environment, how to socially distance and keep it safe. And we're trying to highlight those types of practices as part of the National Safety Stand Down, the fall stand down. So I just wanted to highlight that, and thank you, Chris, for giving me the opportunity.
All right, thanks, Scott. Thanks, Scott. Thanks, Matt. Really appreciate everybody participating. I think this was a really good one, and hopefully those of you who are interested will come back in 2 weeks and review the previous webinars we have online. Thanks so much, and with that, we'll call it a wrap.